28th. Bridget, do we have attendance taken?
Yes.
Do we have a motion for approval of the minutes of June 30th?
So moved.
Thank you, everyone.
Do we have a second?
I'll second.
Discussion? All in favor?
Aye.
Aye.
Opposed? Carried. Next item on the agenda is Vice Chair. Phil has graciously agreed. Phil, am I right on that?
You do a great job.
I'm still thinking about
You
it.
do a great job.
So Phil will be the Vice Chair. Next, amendments to the mental health contracts. Dr. Prezioso. Yeah.
Here, or here?
I don't know which works better, Bridget.
Thank you. Thank you, all. Chairman, thank you. I'm here to ask the committee for approval for basically housekeeping resolution that will also require an amendment to the budget. This comes from time to time. These are monies that are 100% state aid. There's no budget impact on any of this. This is money comes from the Office of Mental Hygiene and from OASAS, which is Addiction Supports and Services, to cover 1%, I think in this case, cost of living increases for our contract agencies. So it's passing the money from us directly from the state to our contract agencies.
Okay, and I see they come in the middle of the year. We've done this before. You have some, all right.
Yes, we have.
Okay. Steve, do we need to add anything to that?
No.
Okay, do we have a motion?
I'll move it.
Second.
Discussion? All in favor?
Aye.
Opposed? Carried.
Great, thank you.
Thank you. All right, the next item on the agenda is the additional funding from Health Research Incorporated. Dr. Kuhles?
Good afternoon. Thank you. This request is to accept a little over $650,000 in funding for COVID enhancing detection. This is federal money that's given to the state, and then the state gives it to local health departments. And this is essentially the large pot of money that supports our case investigation and contact tracers. So the funding will carry us through until March 23.
I'll move that, Mr. Chairman.
I'll second.
Any discussion or questions?
Just real quick, as far as the needs surrounding the detection and the contact tracers, and I see, cases have ticked up, a little bit. It was interesting as I look back to last year at this time, and it's interesting to see the contrast between the statistics. But what are your expectations as far as any additional needs that we might have for contact tracers? Obviously, COVID's back in the news cycle every day. There's talk about masking mandates in certain areas for being inside, indoors. Do you have any visibility on that that you're comfortable discussing? Or?
Well, I think in terms of contact tracers, we certainly dialed down to be responsible with the funds that both the state gave and that the county supported the public health department. But what we did is we kept people active by scheduling them periodically so that their skill set would stay sharp, their accounts were active, et cetera, et cetera. And so we have, I think it's 14 or so that are active now. Of course, we've added hours the last week and a half or so. And should that, continue to rise, which it is likely to continue to rise, particularly among the unvaccinated, we can call on those folks and plug them, right in and not miss a beat.
Okay.
So I'm not particularly concerned about our capacity to respond. Of course, some individuals choose not to participate in, in that. There's nothing that we can do. when we look at CDC's mathematical modeling, the last update in their modeling was July 21st, and it called for between, I think it was 29 and 38 cases a week. We're a little over, we're a little over that. They'll have a new model probably Friday, and we'll see. But we also, what the model can account for is the large influx of visitors into our county, in the summer. I know we're going to do an update, a little bit later, but what I can tell you is here, 69.2% of our population, that includes people that are not eligible for vaccine, have at least one dose of vaccine. And when we look at just the eligible population, 12 and up, it's 79.2%. Right? In a couple weeks to months, very soon, the 6-year-olds to the 12-year-olds are going to be eligible, at least for Pfizer. Moderna will follow soon thereafter. They're a couple weeks farther behind in that, in that process. That's going to bump those numbers up even more. And so we do see breakthrough cases, right? So I can tell you that, get the number here, of the 149,991 persons that are fully vaccinated, we've had 174 breakthrough cases. That's about 1.1% of our confirmed cases, and it's 0.12% of our fully vaccinated individuals.
And you said 174?
Yep. Yeah, I can send this around later if it's of interest to you all. Only nine fully vaccinated persons have been hospitalized. That's 0.006%. So what we learned yesterday is some individuals that get infected and that are fully vaccinated, a small number, very small number, have the viral loads. And so one extrapolates contagiousness from that. They're still doing studies, but that's the extrapolation, that are on par with an unvaccinated individual. So it's the exception rather than rule, and that was verbalized as one of the reasons why CDC changed their recommendations yesterday. But we remain, we're third highest in the state outside of New York City with our vaccination coverage. So I think we remain very well situated to guard against death and hospitalization, severe illness. We'll continue to see, it's likely we'll continue to see breakthrough cases as long as Delta is circulating, and who knows what the next variant will be.
Thank you.
Thank you, Doctor.
But would you send that out?
Yes, I'm going
Thank
to
you.
send something out for everybody later.
Sure.
Later tonight.
Is there going to be opportunity to ask Dr.
Oh, yeah, I think we'll have further discussions on this in the other business section. Any other discussion? Questions? All in favor?
Aye.
Opposed? Carried. Okay, Doctor, I think the next two are related, right?
Well, yes, they are related. I think the next one is the another ELC funding. This is specific funding. Again, it's federal pass-through, very narrowly targeted for testing in schools. And we received 3.9, a little over, almost $4 million for this effort. And we intend to propose, we've identified a sole source contract. This is Quadrant Laboratories. This is an offshoot of the medical school at SUNY Syracuse, my alma mater. And this is the group that did all of the testing for the SUNY campuses. It's a saliva-based. They do pooled testing, and then they automatically, any pool that's positive for the kids, they reflex to PCR. There doesn't need to be another swab. And what's beautiful about this is that they will sequence all the positives. So I've gotten a couple questions from supervisors about Delta. So Delta actually has not yet been identified in a specimen from Saratoga County. It's here. It's because the United States in general does a very poor job of sequencing. It's like flying blind, if you will. And so through this is why it's a sole source, and through this partnership, that we'll be able to really have that granular level of surveillance, because the kids and the teachers will be representative of our communities as well. And so we are working and have been working every week with our districts and our private schools. What they told us loud and clear is they can't do this year. They can't take on any more responsibilities, and they wanted a turnkey solution. And this is the company with a proven track record. It's sole source with that sequencing. It's the whole kit and caboodle. It's the management, the data management system. It's the reporting, both for the school and the mandated reporting to the state health department. And also will give us the sequencing to identify variants.
Okay. Questions, discussions for this first one, number 6 on the agenda, which is to accept the funding? Okay, we have a motion and a second on that, right, Bridget? Do we have a motion?
Not yet.
Not
No,
yet.
no.
Do we have a
I'll move
motion?
it.
Bill?
Second.
Second. Any other discussion or questions for Dr. Kuhles? All in favor?
Aye.
Opposed? Carried. And the next one, if I'm right, Dr. Kuhles, is to use part of that money for the, to authorize the contract with Quadrant, right?
Yes, Supervisor.
Okay, any other thing we should know about that?
They have a proven, they have a proven track record of success with the SUNY system, and we've coordinated kind of a working group of local health departments in the area, and their legislatures or board of supervisors will have to opine, but I suspect many of them will also be working with Quadrant because of this unique product that they can offer to us.
Okay, do we have a motion to authorize that
Make
contract?
a motion.
Do we have a second?
I'll second.
Any other discussion or questions for Dr. Kuhles?
Mr. Chair, how long is that
Yeah.
for, that contract?
The contract will 7/31/22, so that coincides with the funding.
Thank you.
Yeah, I just wanted to point out something I think that's relevant. As usual, Dr. Kuhles is being characteristically modest. It was his leadership amongst all of the departments of health in this region that was able to, not only in the region, but at a state level as well, working with his colleagues around the state, that was able to pull all this together, because there was a lot of unknown. What's the best way gonna do this? Do we even accept the money or not? There was a lot of issues behind the scenes with this, and quite candidly, he was one of the state leaders on this, and he's pulled this region together. They're following his lead on it. It's a group effort, as he said, but I just want to thank you for what I know, and I probably only know a very limited amount of all the work that you and your team have done to make this happen, not only for this county and the school districts here, but on a much wider basis for this region. So,
Thank you.
Thank you very much,
Well,
Dr.
as you
Kuhles.
know,
Another-
since day one, he's done.
I know.
He's done a great job.
Thank you.
Absolutely.
Very kind.
Thank you.
I couldn't do it without the support that you've all provided to our department.
All we have to do is say yes, and then you do all the work. All right, any other discussion or questions?
Yeah, just in terms of these are all subject to reimbursement, right? This is grants, so we have to upfront the money, and we're talking about significant contracts. There's nothing from a cash flow or delayed reimbursement that is going to impact the county.
No.
Okay. I guess-
no, we've got the money.
Okay.
So we just basically signed the contract, and I'm not exactly sure.
Oh, we
the
do get,
mechanics.
we get the money in advance, the pool of money?
Yeah, and then
Okay.
we get it to, we've signed the contract. Each county across the state has gotten a certain amount of money for this purpose.
Oh, I
Some of-
understand.
Yeah,
Okay.
yeah, yeah.
My-
That's
my-
okay.
sorry,
So,
my question's answered.
At least that's my understanding of it, and then,
Okay.
you know, we'll have this contract. I don't know if we give it to them all, you know, how it.
Yeah, in pieces.
Those
Yeah, no,
mechanics, I'm not
understood.
sure, but.
They'll voucher for
Yeah,
us.
you pay as you go, but we're covered.
Yes.
For the amount, so we're the.
Correct.
Yes.
Bank keeper of the money, okay, I'm
The,
good.
the test comes out to, you know, I mean, there's other costs of the
Yeah.
management system and everything, but once those costs are sunk, it's around $20 a test. If you wanna add shipping into the cost, it, you know, might be 21, 22 if you wanna do, we did shipping separate. You know, because we don't know what the, you know, the demand will be. But it's really, they've done a phenomenal job, and it's a homegrown New York, you know, company and test. It's great.
And I'm glad actually you brought that up, because if you notice, in the previous resolution, the total was 3.986 million, excuse me, that we're accepting. This contract's for 3.520. There is an administrative fee that we get to keep to cover the costs of,
Okay.
which is very good for us.
Okay.
Yeah.
Protects us, yeah.
It does, absolutely.
Terrific. Any other comments, questions? All in favor?
Aye.
Opposed? Carried. All right. Next item on the agenda, we have 4 contract tracers, and the idea is to transfer these into major contracts, right, Doctor?
Yes, correct. These are very similar, identical to the ones that you've taken action on in the past. And again, the ELC enhancing detection money, once the full board of supervisors votes to, you know, accept that money, would be used to, you know, to pay the contact tracers. These are, we've kept our, you know, our best. You know, at one point we were up to 40-ish. You know, some have gone back to college or things like that, but we've kept our best, and these are 4 of them.
Sounds good. Can we combine these into one motion, all 4?
I'll make that.
Yeah, okay, do we have a motion?
For all 4,
So
A, B,
moved.
C, and D.
So moved by Supervisor Grasso and seconded by Supervisor Lamb.
Okay.
Any discussion? All in favor?
Aye.
Opposed? Carried. Okay, next meeting changed a little bit to August 31st. I hope that's okay with everybody.
What date was it?
I think it was the week before,
On a Thursday or
or Wednesday.
Tuesday.
Oh, I see.
Does that sound good to everybody for next meeting? Eric, you okay
Yes,
with that?
yeah, it's my wife's birthday, but.
Well, bring her along.
Yeah, she'd probably love that.
Take her out.
Yeah.
As part of the
Take her
present.
out.
she
You can
could
go downtown.
shadow me.
McDonald's right up the
Go to
road.
downtown
Right.
and swing over to the meeting. Make a night of it.
Okay, other business. Phil, you wanted to talk about proceeding in HR?
Yeah, thank you, Mr. Chairman. I just wanted to update the committee for those that weren't there yesterday. The HR committee approved the addition of the position of Director of Environmental Health to the compensation schedule, creating that position. That was the recommendation of the DOH Transition Task Force to establish that position and provide the person that'll be leading that section of the Department of Health under Dr. Kuhles' sound leadership, and build out the department using their expertise and giving them the opportunity to be a part of that process, as opposed to building it out and bringing in the leader of that section of the department after. Makes much more sense, and we think it'll make it a more enticing opportunity for somebody that would like to come in and have the opportunity to be part of the small group that'll be leading the effort to build out the Department of Health. So we think the timing's good. Obviously, we need to move forward on this initiative as quickly as possible. We're working with the state on many levels, including hopefully garnering some grant funds to offset some of these upfront costs. Nothing's been committed yet, but we're working that side of it as well. We have a letter going to officially request from the Department of Health any funds that might be available to help with the upfront cost of the transition. Supposedly, there is some money that might be in an account for this purpose. As Administrator Bulger explained at the last meeting here today, it's been 2 or 3 decades, I guess, since county has gone through this process. So there's not a lot of folks at the state that have experience with this type of thing. So we're trying to identify where that money is, if it's there, and this official letter requesting assistance will hopefully go a long way in getting there. And I should say, in correspondence that the state has sent to the county asking us to move this process along, they did mention that grants may be available. So it is something they brought up as well. So we'll keep pushing that. But right now, just want to update the committee on that. I think it's a big step forward. Dr. Kuhles has been also now working on information relating to the positions that'll be under the director, such as engineer, sanitarian, so on and so forth. So it's going great. I want to thank everybody on the task force, everybody on this committee for their help.
Thank you, Phil. Yeah, that sounds great. Looking forward to that change. Terrific. Okay, next item under other business is just to talk about the recent developments on the COVID front. So Doctor, maybe we can talk about first, the CDC change in recommendation that was, I think, today or yesterday, and the governor's announcement this morning, and how we can prepare for this and what we can do.
Yeah, so, yesterday, about 3 o'clock, CDC had a press conference announcing a change in their recommendation for fully vaccinated individuals. And the change was for those fully vaccinated individuals that are in a area of substantial or high transmission. I could certainly go into how that's defined if you're interested, that they wear a mask indoors. Previously, that the last CDC change was that mask was not needed, and the rationale, as I mentioned earlier, was that it's the presence of the Delta virus that's circulating. It's over 80% of the sequence specimens that are have been identified in the U.S. It's no doubtly it's here in Saratoga County. Some individuals that get infected that are fully vaccinated can have a viral load. A very small number of these individuals can have a viral load, quite high and on par with an unvaccinated individual. And so the extrapolation is that high viral load implies contagiousness. There have been some clusters of cases amongst fully vaccinated individuals, I think one in Provincetown on the Cape. I don't know the details about those individuals or that cluster or their immune status, things of that nature, but that's what led to the change. The other change that was announced yesterday was a recommendation for universal masking in schools of students and staff. And so that was 3 or 4 days earlier, the American Academy of Pediatrics came out with the same recommendation. We've been working with all of the counties from Columbia to north to Essex, over to Hamilton, all the BOCES and all the schools together as a region to come up, in the absence of action or recommendations from the state, on how to translate these this guidance and to really get into the weeds on how operationally for the schools so that we can keep children in school safely. And so, this was one of the questions that some districts had is, will masks be required or not? This is a recommendation. The CDC has no authority, to my knowledge. I defer to the lawyers to order. It remains to be seen what the governor or the state health department may do. The state health department has emergency regulatory authority to issue emergency regulations should they choose. Those are generally good for 90 days, and then they either sunset or need to be renewed as an emergency order or made permanent. The governor today, he announced that he would be requiring, we've seen nothing in writing, so sometimes the press conference doesn't always translate, but state employees and contractors to either be tested weekly or to be vaccinated. New York City has done that, Los Angeles, some other, St. Louis have, some of these places have done that. I believe the president may have announced today, it was supposedly going to be announced that all federal workers and contractors will need to be vaccinated or tested weekly. And the governor also announced at state hospitals or state healthcare facilities, which I think include the state-owned and operated nursing homes, vaccination only, no option for testing. And so the needle seems to be moving from incentive to mandate in some cases.
Was there any, in terms of the testing or vaccination, did he talk or did the president talk about who pays for these tests? Is it going to be the person, or is it going to be the employer or the government?
I did not see the president. I only saw a little bit of the governor, and there was no mention of that. One of the items on my to-do list is to ask that very question of nursing home employees who have been required to, unvaccinated nursing home employees who have been required to be tested. Is that something that the employer is bearing the cost of, or is is that person's private health insurance doing it? And maybe there's not a copay for it. I need to investigate that and how that cost would be borne.
So I'm assuming the schools are going to go along with the CDC guidance.
I can't speak for them. I would think that the majority or almost all of them will, but I can't speak for them. There may be different circumstances. Some of the smaller, schools may, think that they have enough layers of protection if they do testing and 6 feet and things of that nature. But that's part of this summer work group where we're trying to harmonize between the BOCES, the 3 or 4 BOCES in the area, all these, 9, 10, 11 local health departments and all the public and private schools trying to harmonize. I don't know that we'll be 100% agree on everything, but both the AAP, and now the CDC have made that recommendation.
Are they also talking about social distancing in the schools, or is it just masks?
So CDC recommends a minimum of, to try to maintain whenever possible, a minimum of 3 feet of social distance. They've also made a change in their recommendations for quarantine, and importantly, I wanted to point out that I am no longer under an order from the governor to follow the state's decision on who requires quarantine and who doesn't, right? And they have a different definition than CDC and WHO. So hold that for just a second. What it means in the school is if they're between students, as long as the students are more than, if they're between 3 and 6 feet and both are wearing masks, one student is a case, the other one is a close contact, that contact does not require quarantine.
Right.
So it's not for teachers or adults,
Right.
but it's student to student, and, you know, there's some data behind that, but it's also the fact that we need to keep kids in school for a host of reasons for their own physical and mental health, and also for society.
But should a school feel compelled to follow that 3-foot rule, you're talking every other day schedules. They're not gonna be going to school every day.
I don't know that most of, you know, honestly, I can't speak for any school, but
I can speak as a teacher, that 3 feet will not permit normal class sizes. There's no way.
you know, I think you're in a, you know, in another
County,
Yep.
true.
What we've, you know, our first main topic was busing. That was last week. We had good harmony on that, but some of the same questions. Mask, well, it's required by a federal order, but do we need to keep 3 feet or 6 feet? And no, you know, we need to bus, to get the kids to school, you gotta put them on a bus.
Yeah.
Right, and so the
So
next
what's
topic.
the point of 3 feet if they're bussed in next to each other?
The next topic is going to be extracurricular activities, including, you know, high-risk sports.
Right.
But what we're hearing is many of the schools, and I'm not there, that's why your real-world experience is so important. Many of the schools think that they can make 3 feet work in most cases. It's not an absolute requirement anymore.
Right.
If a school cannot maintain 3 feet, the recommendation is layers of protection. And that's where the testing comes involved.
Okay.
That's where ventilation comes involved. That's where really encouraging, you know, sick to stay home, right? So the whole, it's you can think of it as Swiss cheese, right? All the holes,
Right.
but when you lay up one on the other, the holes disappear. And so, you know, the thought is that combination for those situations or schools that can't do 3 feet of distance, that those layers may, you know, allow them, should they choose to have kids in school.
You know, you mentioned sports, which will be starting pretty soon,
Yes.
about 3 weeks.
Football.
So there's no standard that's been set for the coming season. You had one last year, but did that run its course and now it's kind of wait and see before there's any new standard that might be set, or as far as the infection rates?
So the you know, the requirement to have, you know, sunsetted with the governor's executive orders, you know, emergency authority going
Right.
away. CDC and their recommendations at times when the community is at substantial or high community transmission does not recommend that higher risk sports continue. Now, I think we are talking as a group and then continuing to work on this. There's certainly, I think, differences indoor, outdoor, right? And time of year, temperature, and humidity, and so we're trying to craft an approach that is balanced. We're also hopeful that the number of most of those sports, you know, the kids over 12, you know, you're talking, you know, 6th, 7th grade. So all of those kids at sports teams, whether it's a 7th and 8th grade team or the modified team, you know, have had an opportunity for vaccination. It also remains to be seen what the New York State Public High School Athletic Association may do. The NFL has, you know, maybe a model for them. Pro sports often are with testing and things, and so they've put in some rules this year where the game is forfeited. If you know, if there's COVID that can't play, the game is forfeited, and so that.
If you have unvaccinated players, yeah.
What do you think the possibility of Saratoga County or the region graduating from moderate into higher substantial?
I think it's a matter of time. I think it's likely.
Oh, really? So fall sometime you think we'll be subject to these CDC recommendations?
I hope not, but,
That's possible.
you know,
Certainly we have to be prepared for it.
we need to
That's for
be,
sure.
you know,
In the short term.
in the short term to be prepared, and I think a lot of it, you know, may be the influx of,
Yeah.
you know, of,
And it seems right now
Track.
that the governor might be leaving this decision to localities rather than instituting a statewide mandate on it.
those are
Unlike
the words
before.
I heard today, and he did something, I think, on Monday as well. You know, this Delta variant is so much more contagious than the wild type or even the B.1.1.7 that it really is just going to go through unvaccinated individuals quite quickly.
So transmissibility of Delta is greater than in Alpha or the others.
Yes.
How about hospitalizations and fatalities? Is that percentage greater with Delta than with the others?
So what we don't know yet is whether it causes more severe disease than the other variants. It's going to be hard to tease that out because so many are vaccinated now. It really, the risk is obviously greater because they're unvaccinated, but one could, you know, reasonably conclude that other risk factors for severe illness like age, obesity, diabetes, chronic medical conditions, etc., you know, will put those unvaccinated individuals at even greater risk of severe illness and hospitalization. I want to just let folks know that, you know, 93 point, when we look at age in our seniors, and you heard me talk extensively about that in January, we're up to 93.2% of our seniors with at least a dose of vaccine. And so, you know, where that balance is, we don't look like Missouri.
Yeah.
And these other states where their hospitals are overwhelmed. And so, you know, we can talk about case numbers and infection, but my eye is going to be on hospitalizations and deaths. And what we're not seeing, again, is that translating right now into the surge into our healthcare system.
Largely due to the vaccinations.
And the vaccination is, you know, even against Delta, remains incredibly effective, you know, 93, 94% against severe illness, hospitalization, and death. Just looking again, I want to repeat, only 9 of our almost 150,000 roughly fully vaccinated individuals, only 9 have been, you know, had a breakthrough case that required hospitalization, 0.006.
I mean, that's a convincing number. So convincing that we kind of hashed around an idea, you know, today about, you know, just publicizing website or whatever, the numbers. I mean, chances of you're getting hospitalization or fatality for unvaccinated, boom. Chances for vaccinated, boom, or the numbers, and just put these numbers out.
Yep.
So, because, you know, we're going to have some people reacting to the mask thing coming on, saying, well, if I have to get a mask, why should I even bother? You know, you're going to have that reaction, I think. And to counter that, you know, if we have this data put out and people look at these numbers and say, well, if I get vaccinated, I have almost no chance of either having to go to the hospital or dying. If I don't get vaccinated, I have this chance of it. I mean, that's a real clear, you know, choice to put to the people, one that might convince them to go get vaccinated.
I think it's very compelling data, and that's certainly the message that,
Smarten them up, someone.
you know, that I'd like to, you know, continue to carry with your support and the board's support and Mr. Bolger's support. It's very compelling, and you know, you also think not just about yourself, but the people you live with, or if you go to see, or if you have older parents, if you have grandkids, you know, your loved ones, and so.
Okay.
And it's also a message that, I hope public health can do a better job of communicating to healthcare providers this data so that they can use it to talk to their patients. You know, I'm of the mind that many people don't want to hear from government.
Not that I don't like you all or Mr. Bolger, but my doctor, you're a good guy. But my doctor is going to be, if I'm on the fence or if I'm against it, it's, kind of like smoking cessation. It takes a couple times, right? Or you pre-contemplation, contemplation. But that doctor is a more powerful messenger, or your loved one or your friend, than government. Right, and so what can government, it's not that we don't repeat that message, but I think we can do a better job of getting data to healthcare providers so that they can communicate this. I think the unvaccinated will listen more to them than government.
It seems like we're, over the past, a couple of months, we've moved to where we've had a different in treatment for people that are vaccinated versus unvaccinated in terms of having to wear a mask indoors. But the enforcement of that has been a very passive approach. And I'm not familiar with the governor's statements today, but it sounds like the state is starting to require, right? Is it proof of vaccination or testing for state agencies and their contractors?
That's what he verbalized.
Right. So is that something that's at a state level and maybe federal level? Are we going to be expected to have to make that decision at a county level? Is the county going to have a mandate like that, or do you?
I mean, I think you're also the Board of Health, in addition to the Board of Supervisors, and so that's a policy question that will need to be addressed, and I can provide subject matter expertise and technical expertise. I do think that there are quivers in the arrow, or quivers in the bow, if you will. I'm mixing my analogy here, but some jurisdictions are trying things like, if you get COVID, if you choose not to be vaccinated and you get COVID, we're not going to allow our insurance to cover that bill, or things like that. So, there are still other, possibilities out there. But what's clear is, even against Delta, which behaves differently than the wild type or the other variants, is that vaccine protects against severe illness, hospitalization, and death. Will there be breakthrough infections? Yes. There'll continue to be more. The rate of them is going up because Delta is circulating more. But if you don't want to die, this is something that you should consider. Personal choice, but something that you should consider. And I want to give that data to the healthcare providers, to the public, and with your support.
Do we have data about the vaccination rate of county employees?
I would, we would need to work with, HR, about that. Obviously the vaccine.
Is that something that we need to work on in order to make decisions?
I would think a de-identified, I've got to be careful because of, medical privacy, but I think a de-identified, we'd have to talk with the county attorney about how to do that the right way, but I think that would be, a valuable data point for you all as the Board of Health and Board of Supervisors, should you choose to, consider that as a policy option.
Chairman.
Yes,
Can I
Supervisor
ask a
Gaston, yes,
question?
sure.
Understanding the difficulties in sequencing and availability, do we have any data suggesting it or not for the Delta variant right now? I know the Alpha variant was like somewhere between 2 and 3.
There have been some estimates of 5, 6 from other parts of the world, but nothing concrete.
Okay, and for those who
That's obviously amongst the young vaccinated.
Right. For those who may not be as familiar with or not, so that's the number of people that a case may be estimated to transmit to. What is that? What disease might be comparable to that?
Measles is among the most contagious
particularly respiratory pathogens that we face, and then that has a similar, if that, ballpark estimate proves true, similar or not in terms of its infectivity or contagiousness.
Thank you. I think that's also a piece of information that could be used as part of the messaging. Because I think when we say it's more transmissible, people don't necessarily know what that means, and being able to put an actual number or illustration that they may recognize from previous instances may help. Because I know, at least in New York, we're very familiar with measles outbreaks, and so that may be helpful. Thank you.
Thank you.
One of the advantages, is, like again, and Saratoga, is that, with our coverage, hopefully you'll see that amongst particularly many unvaccinated individuals may, they may not be wearing their masks as well, and that's where you're going to get, like I said, and Supervisor Gaston putting it in an epidemiological term, that very rapid spread in those cohorts.
Okay. Any other business? Any other questions, discussions? Okay, do we have a motion to adjourn? So moved. Okay. Discussion? All in favor? Aye.
Aye.
Thanks very much. Very good meeting.
Thank you,
very
Darren.
much, Doctor.
Thanks.